Hello, everyone. Thank you so much for joining this webinar today, co-hosted by Voices for a Safer Tennessee and the University of Tennessee's Boyd Center for Business and Economic Research. My name is Claudia Huskey. I'm the Executive Director of Safer Tennessee. We're a nonpartisan nonprofit coalition founded by Tennesseans in the wake of the 2023 Covenant School tragedy, and we are dedicated to advancing Tennessee-based firearms safety policies and programs that both protect communities and respect the Second Amendment. The new data dashboard is a vital addition to our toolkit, allowing us to communicate with stakeholders across the state about how firearm tragedies, from homicides to the often overlooked issue of suicide, affect their local communities.
We felt at Safe Tennessee that it was needed for several reasons. What we saw with the Covenant tragedy, the Antioch school shooting, the high rates of firearm suicide that we've been seeing among our veteran population and increasingly our youth population, really was indicating that firearm injury and death in our state was on the rise. But when we began sitting down with legislators at the Capitol and having discussions in some of our more rural communities, there was a perception that this was just an urban problem affecting Nashville, Memphis, Chattanooga, Knoxville. So we wanted to dig into the data and understand how all of Tennessee's 95 counties have been impacted. We also wanted to get a better understanding of what the repercussions were of a firearm tragedy, because we know the loss of life carries a ripple effect, impacts not just the emotional well-being of a family and a community, but a family's economic stability. So just like when you're sick, your doctor needs a diagnosis to create an effective treatment plan. Getting an accurate, granular picture of the firearm injury data and firearm injury and death data in our state really has been key to make our communities safer.
Tennessee is a great state in many areas, but as a health economist in particular, I'm always struck by that despite the progress that Tennessee has made in education and economic development, we're always and nearly always in the bottom 10 for almost every major health indicator that there is. And if you're going to improve something, you first have to measure it as a baseline to know where you're even starting. But when we see numbers that we don't like, it's a natural reaction to say, well, that can't be right. And that's where we understood was happening in policy conversations surrounding the data around adverse outcomes from firearms. The reaction when confronted by the severity of the data was that, well, these data came from outside Tennessee. We can't trust that. And we realized that as a fiercely Tennessean nonpartisan research center, that we were in a position to help with that. So in a policy conversation generally, there's basically four key questions. There's one, where are we now descriptively? Just what do the data say? Two is, how do we feel about that? All right, where are we now normatively? Three is, where do we want to be? Or what are we willing to deem acceptable? And four is, how do we get there? And if you don't have a good answer for number one, you're basically cooked. There's no way to proceed, to find common ground, or even talk about solutions because we have no assessment of the scale and scope of the problem that we're trying to solve. So our role in this conversation is really to provide that answer to number one, where are we now? And we're not telling anybody what to do with this, right? That's items number 2, 3, and 4. But our objective is to be able to say where we are now. So right here we see it says that there was 1,622 firearm-related fatalities in Tennessee in the year 2023. A lot of times people talk about firearm tragedies. The first thing that we're usually talking about is homicides, but suicides actually make up a majority of the firearm-related fatalities in the state. In both cases, though, right, among survivors of attempts on their life, and also amongst people who've been involved with interpersonal firearm violence, most of these tend to be impulsive acts, right? That a lot of lives would be very different if somebody could just get 10 minutes of the life back to make different choices. But we also break down the firearm fatalities by demographics, and so you see that homicide victims and suicide victims tend to look a bit different, right? That your homicide victims tend to be younger, but most of your suicide victims are older. And so in 2023, the economic impact of firearm violence was about $4.49 billion across the state, which is $600 per person. Every man, woman, and child in the state was the economic impact from firearm-related tragedies. If you want to be able to go to a specific health region. So one of the things that Erin brought up was the perspective that some people had, or that was commonly held, I guess, that this was mainly an urban problem. And so part of what we wanted people to be able to see and then form their own opinions about was how severe how severe is the firearm tragedies problem in your local area. And so you can select an area, whichever one's interesting to you, whether it's East or whether it's Upper Cumberland, and be able to get some statistics and breakdowns on the value of lives lost and the value of hospitalizations and what the per capita cost is. But it's also worth considering how Tennessee is doing relative to the rest of the nation. So unfortunately, we're in the bottom 10 for most major health indicators, and firearm violence is no exception. So we were number 9 on a per capita basis when compared to the other 50, compared to all 50 states in terms of the firearm fatality rate. And so we had 22.7 incidents per 100,000 residents compared to a national average of 14.7. And if we go back to where we were 10 years ago, or 10 years before 2023 is the last available year for which we currently have comprehensive data. We can see that we were above the national average then, but as a state, we're getting worse. We're continuing to diverge from the national average. At the start of our data collection period, we were number 13. Now, as you can see at the end, we're up to number 9, or down to number 9 as the case may be. That firearm deaths have increased 60% over the last 10 years. We can also break this down by subtype. That in terms of homicides, we're number 5 in the country. In terms of suicides, we're number 11, although evidence on the next page will sort of indicate that by the time we do get the refresh data on this, we probably are in the top 10 for both homicides and suicides. Generally speaking, your urban regions tend to do a little better. The rural regions tend to struggle more with suicides. The rates tend to be higher there. And again, for those of you that want to see the snapshot and the regional breakdown year over year, rather than the overall trend line, you can choose the year and see kind of where your region was, where neighboring regions were, where other regions were 5, 10 years ago, and then be able to see where we are now.
Sure, yeah, that sounds great. Thank you to all the folks at Safer Tennessee for allowing us to be a small part of this. I should start with the framework that from the Knoxville Police Department, we really view ourselves above almost anything else as a data-driven department. And what that really means is that all of our strategies, whether it's crime reduction, crime prevention, resource deployment, accountability measures, just general management of the department is based on data. So we view ourselves first and foremost as a data-driven department. And so kind of going back to what Matt was talking about like the importance of this, some of the foundational pieces of this whole database is understanding the problem, right? And so you take a look at the data to understand the problem, and then you respond to that data, what it tells you, So some of really on a foundational level, what we look at when it comes to violence reduction is trying to understand based on the data, where are the places, the very localized places that are the most significantly and disproportionately impacted by violent crime. Violence is driven by a very, very small number of people. So who do we know based on their connections to reported violent crimes that occur, whether those are shooting incidents, other violent crimes, their connection to that, who do we know is involved in driving violence in the community and then putting pressure on those individuals? So when you're looking at it from the context of violence reduction, those are really important parts of us, of how we kind of go about approaching violence reduction and violence prevention. It's really important to talk about, again, where we came from and where we are today. You see here, these are gun homicides. You saw the numbers, how they shot up into like really, really unprecedented territory for us as a city in 2020 through 2022. But since then, we've seen a really dramatic decrease. That's through some of the partnerships that we've developed with other law enforcement agencies, as well as partnerships like this. I think it's a lot of people that are working in concert that have helped drive down violent crime. We got the numbers that here through 2025, where we matched a 10-year low for homicides in the city in 2025. And then that really continued into 2026, where we didn't experience our first homicide until May 7th. Yeah, this dashboard is really important for a number of reasons, because from an educational standpoint, it's really beneficial because it shows you, it really puts in really stark terms the scope of the problem and the effects of the problem. It's not just the lives lost or forever changed. There's also there's a much greater ripple effect for the whole community. I think that's why research in these projects are so important, is because people have perceptions, they have ideas, they have notions, and then these things can sometimes push back on those notions.
Thank you, Scott. It's really encouraging to see an example of a police department like yours using data to inform practices and engage with communities you serve in a targeted and productive way, and that real progress can be made toward reducing and we hope someday eliminating firearm tragedies.